Good afternoon, everybody. I'm here, Sharon Spurlock from the St. Louis ARC Family Support Team, and we're here to bring you information every week about things that we think are going to be of interest to the community in general, and especially to people with disabilities. Today, our guest is going to be Karen Lanter from St. Louis Health Equipment Lending Program, otherwise known as St. Louis HELP. So, without further ado, I'm really happy to introduce Karen, who's going to tell you a little bit about herself and about Louis Help. Hi, Karen.
Hello, thank you so much. Again, my name is Karen Lanter, and I'm the Executive Director of the St. Louis Health Equipment Lending Program, which is also known as St. Louis Help. We have a mission of collecting, cleaning, repairing, and giving away home medical equipment. And we've been doing this since 2008, diverting tons and tons of home medical equipment away from landfills and into the homes of people who need it. We do not have income requirements. And our thing is to get as many pieces collected as possible so that we can help as many people as possible. Given that the healthcare environment, it can be very challenging to navigate the different public and private insurers. So St. Louis Help, we pride ourselves in serving people quickly when the need is there. When people need help, I want to really draw their attention to our website, which is an interactive website. It's stlhelp.org. So 24/7, people can request help. And we have right along the top, get help. And this is for family members and caregivers and friends. They can request help by clicking this button right at the top. It's also available along the menu bars under health equipment when it says request help. When you click that, you go to the request help page. And it's got information about our many locations that people can drop off used home medical equipment and that they can request home medical equipment for themselves or maybe a friend or a family member. So this is the simple form here on the right, this request help. And this is the fastest way to get help. We have a phone number, which I'll share with you here in a moment. Well, it's 314-897-HELP. But the fact is, by having somebody fill out this simple form right here, ask height and weight, who do we contact, what do you need, hit submit, and that is so simple, and it makes it easier for our dispatcher to be able to get back with people. She can see right away what is needed so she can check the inventory. So we really encourage people to use our website. However, we know it's not good for everybody. Not everybody has a website. Some people their vision may not be good for a website, in which case, call us. And in fact, you can call us Tuesday through Friday, 9 a.m. to 4 o'clock in the afternoon. On Saturdays, it's 9 to 1:30 p.m. And you'll get an answer within 24 to 36 hours. You might say, what kind of equipment do you have? What does St. Louis Help have? Now, since I want to let you know that since 2008, we're a not-for-profit, we're 501c3, we have been carrying out this mission to help people, to improve their the availability of equipment. What we need. We have, say, Invacare hospital beds. That's the main type that we take. Incontinence products, even open packages, pull-ups, bed pads. We don't take diapers because we find that very few people request the diapers. We do, though, keep the pull-ups for people. Dry shampoo, wheelchairs, including manual wheelchairs, transport wheelchairs, pediatric equipment. We have got more than, oh gosh, 100 pieces of pediatric equipment, and we get more all the time. Variety Club, which of course provides free home medical equipment for children, the wheelchairs and such. They refer the parents for when their children outgrow those items to us. And you might say, well, doesn't their insurance cover that? It's really interesting. And it was very eye-opening for me to see that how many people wrote that they were waiting for their child to get a wheelchair. The wheelchair had been more than 6 months. And then when the wheelchair arrived, more than you'd think, and the child had outgrown it. So then we get this brand new wheelchair, and the parents are there because the insurance won't pay for 2 in 1 year, no way. And they won't take it back either. So they're going through our inventory in hopes that they can find a wheelchair that'll work for their child. So pediatric equipment, we need those. We have lift chairs. You know, they look like recliners, but they'll lift somebody up so they can get out of the chair. Bathing assistance items, you know, walkers and wheelchairs, even the Hoyer lifts when somebody can't get off the floor. We've got those things we don't take. Bariatric beds, and that includes the Invacare. It's just they're just too heavy. We can't move them around. Adult diapers, I mentioned that. We don't do anything to do with blood, or certainly not like a defibrillator, electronic equipment. It's more of the mechanical, although some of our Hoyer lifts are certainly, you know, they're certainly, they have motors associated with them that we can take, but certain things like stair lifts, chair lifts, we don't do that because a lot of times they're custom to the house and our insurance just thinks that it would just be too risky for us. No ostomy products or tube feeding. I think it's worth pointing out here. I just want to, before I open up to questions, I want to point out that we're now available to drop off and pick up items 6 days a week. And while we don't have, there's no walk-in pickups. You need to call, or better yet, go to www.stlhelp.org to request help. But we are now available throughout the St. Louis region through wonderful partnerships with like-minded organizations that allowed us to join with them to better serve people in the community. So on Saturday, these Saturday and Wednesdays, these are the ones, the warehouses that we've had open for a long time. We've got 2 warehouses. One is in Olivet off of Gilman Rock Island Industrial Drive, and the other one is in Crystal City off of Bailey Road. So we're serving Jefferson County. And that's on Saturday and Wednesday from 9 to 1:30. On Monday in the city on 7th Street at Love and Action Health and Wellness between 10 and noon, one can pick up items that people need. Once they get, of course, they have to be reserved, as we explained, and then also drop off items to be donated. And that's Tuesdays and Thursdays. We've got Abiding Savior Lutheran Church in Melville, also known as Concord, from 10 to noon. And they're doing the same thing, collecting and distributing home medical equipment. We, by May 1st, we had gotten more than 200 pieces from Abiding Savior since January of donated items from the community, which is really fueling our ability to take care of some of our lower income populations. St. Martin United Church of Christ, that one is in High Ridge, and they're 10 to 2 on Tuesdays and Thursdays. Finally, on Friday, we've got the care service, which used to be known as St. Joachim and Ann Care Service in St. Charles. So we have our presence in St. Charles, and that is from 9 to 3. And then there's also Love and Action is at St. Stanislaus Polish Catholic Church in North City from 10 to noon on Fridays. I realized I left out on Tuesday, very important, Aging Ahead. We partnered with Aging Ahead, which has the senior centers, and they on Tuesdays from 9 to 3, where they're collecting and distributing home medical equipment to people in the greater Lee May area. Are there any questions?
Yes, we've got 4 questions, maybe 5 already. I just want to say how amazing it is that you have these different pickup sites because we also have an equipment program and it is very cumbersome to move all the equipment back and forth and do all of that. So that's a real commitment for you guys to be close to where people are. The first question we had was asking whether Greater St. Louis included people in the Metro East area. If somebody's in Illinois, can they get equipment by going into the city location or the South County location, or is that only for St. Louis folks?
We do not have any locations in Illinois. However, we don't turn away people from Illinois. I live in Illinois myself. But anyway, if they're able to, they can enter the system the same way by going online, stlhelp.org, or by calling. And if we got the item, which a lot of times we do, make arrangements to pick up at one of the locations. But yeah, they'd have to come to Missouri to pick it up. That's the difference.
That's okay. That I think that that's a great resource for people. There's a few questions about donations. My first question was, do you have to make an appointment to drop off a donation? Or are you able to just walk in?
You can just walk in.
Okay.
The locations in the city, I want to go ahead and say they want to call first.
Okay.
Okay, but we got the phone numbers down on what I have listed here because just as a safety thing. But they're asking for a call first on the locations in the city, which are 2 of them. Other than that, you just show up and drop off during our open times.
Okay, and then we've got 2 questions about delivery. For things that are oversized, like those beds, either for donation or pickup, does the family have to arrange for that transportation, or is there ever a delivery option?
When it comes to pickups, I mean, generally we say we don't do pickups and we don't do deliveries. I mean, of course, we have to say that. You can imagine it would be overwhelming for us. But we do when people have got like a juicy Invacare bed. I'm sorry, I use my terms. What that means is we're having a shortage of particular items, and then we find out that there's big items and they're in one spot. I'll send my guys over to pick it up, depending on, the quality. And if it's something we need, we don't automatically agree to pick up everything. But in many cases, we go out. In fact, Tuesday is one of our pickup days. So we do pickup and drop offs. Now, in terms of like say delivering a bed to somebody's house or something like that, that is, we really avoid that. We will take a bed to one of our partner locations in the community nearest to the person, and then they can pick it up from there. But we really prefer if they come to our warehouse for that.
That makes total sense.
Yeah, because we've got docks and stuff, it makes it easier. So you can really roll it out and all that good stuff versus improvising. These beds often weigh 300 pounds.
Oh, it's amazing how heavy those things can be. All right, so the next question is sort of about eligibility. They're wanting to know if there's a particular age range that you serve, or if they just contact you based on whatever their needs are. And I'm going to add to that, beyond age, is there any other kind of eligibility?
This is the beautiful thing about St. Louis Help, okay, is that no, we do have no age limitations and we have no income requirements. We do focus on, of course, St. Louis City, County, St. Charles, and Jefferson counties. But we even accept people coming from outlying areas if they're able to pick it up, as I mentioned before, or Illinois, for example. And no, we don't ask for proof of income. We don't ask them if they're a particular age and they don't qualify because of that. That's the beauty, is it's so easy, and it's neighbor helping neighbor. They're cleaning out, everybody, the loss of a loved one is horrible. And they'll look at all the stuff that they had to take care, to care for their loved one. And what do they do with it? Well, we're the solution. Drop it off at these places, and then we'll clean it up and we'll get it into the hands that will improve the quality of life for your neighbors. And this is entirely free in every way.
Well, and I know I'm working with a family right now that wants to try out a particular style of walker, and they're not sure that their family member is going to do well with it. This is a really nice option for a family to be able to do that before committing all their insurance dollars or other resources to that. So another question that we've got is whether or not this is sort of a turnaround. If somebody uses an item and it's still in good condition, can they donate it back?
Oh, we want them to. And in fact, I'm glad you brought that up, Sharon, because a lot of times people will think of it because we call it an equipment lending program. So they'll picture it like a library book, that they'll have it for so many weeks and it'll, it's been stamped and then they're going to have to return it, or we'll be charging fees or something. We do that. The title of the organization is based on encouraging people to recycle. We don't need them to bring it back at any particular time. They could keep it for good if they need it. They could give it to their brother-in-law if he then needs it after them. They could give it to their neighbor and we'd be really happy, right? Because it's continuing its life out helping people.
Well, I don't think as many people realize what you talked about earlier, that insurance doesn't exchange, doesn't return. You might need a piece of equipment because you're temporarily going through an operation or what have you, and then your basement's filled with potty chairs and walkers and things that nobody in your family is using but could be really useful to somebody else. So I think the recycling aspect is really important. And I always hate to get it through my insurance because I know exactly what's going to happen. It's going to be used for a few weeks and then not be used at all. So we do have a really interesting question. I have a feeling that you could talk for a while about this, Karen, but they're just talking about how neat it is that this company exists, and how did it get started? What drove the creation of St. Louis Help? Tell us the backstory.
Well, it was a lady named Laura Cannon began this, and it was back in 2008. It was really 2007 because they, had to, before they incorporated in the state of Missouri as a 501c3 not-for-profit, they began collecting in their garage and basement for people in South City. I'm sorry, South St. Louis. And they had a number of items, and it was based on seeing and experiencing the difficulties of people have at trying to get what they need when they get released from a hospital. It was like too often it's seen, where persons being released from the hospital, but then they can't leave unless they have a wheelchair. So it's this real chicken versus egg thing. Well, how do I get to go home? Well, you have to go home, but you need this and that. So she identified along with her father. And there were a few core people who began and who are still, in many cases, if they're still alive, they're still working with our 501c3. That decided that it was time to try to organize this and to do it right. And I got to tell you, Sharon, it's been so interesting because we are arguably, and we're not very large. We're a $400,000 charity in St. Louis, but we're arguably the largest in the United States.
Isn't that amazing? How
So
many
they,
pieces of equipment do you think that you loan out annually?
oh, we know. We're tracking all of that. Okay. So I'm going to say roughly around 4,000, getting about 6,000 to 7,000 pieces donated. So people say, oh, you got plenty. It doesn't work that way. Because if everybody wants bathing equipment, for example, we could have tons of these little walkers over here.
Yeah.
So it doesn't just match up based on need. And I think many of us know about how bathing equipment is not covered by public or private insurance, sadly, in the United States. And of course, it is needed for stability and safety for all of us, but it's not there. So that is a huge demand that we help to fulfill here in the St. Louis area.
Well, I would be remiss if I didn't share some of the comments in the Q&A with you, Karen, because they are just really excited about St. Louis Help. One of them says, this is just such a needed service. I can't believe I'm just hearing about it. And then another, wow, just wow. Thanks for all you do. So that's pretty cool. There is another question, and I'm pretty sure I know the answer, but if I have a family member that's 3 hours away, if I am willing to get you the equipment, you don't care where it came from, right?
Oh, heck no.
You probably don't care where it's going either. If my
No,
family
no,
member's down in Steelville and I can get them the bathing equipment they need, I could apply through you.
that's right.
Rock on. This
Yeah,
is
we
so
don't
exciting.
prioritize it either. It's first come, first serve. We don't go, oh, well, this is closer. No, it's first come, first serve. We understand that when families are in situations and they got to take care of loved ones, we got to do what's necessary.
Yeah. Is there anything else on the website that you think people won't need to see, or have you gotten through
Hmm.
all the pieces that you wanted to share?
I think the main things, I think this really, especially giving the schedule and to remember that there's no walk-ins. Because that'd be very confusing. If Mr. Jones has already reserved a particular lift chair, and then Mrs. Barry walks in and ends up walking out with getting the lift chair, then that could get confusing. So that's the way we keep it fair. First
Yeah.
come, first serve, no walk-ins.
Well, I'm going to ask you one more question. And audience, this is your last chance. If you've got something you want to ask it now. I want to ask about, you said it's a $400,000 organization. How are you funded? How can people in the community support you as a volunteer? Or do you have special events? What should we know about that?
I'm really glad that you asked about that, Sharon. Uh, to me, it is an example of what makes St. Louis just so great. Because how we exist are through foundations throughout the St. Louis area that know the importance. I mean, for example, we're funded by the foundation of Barnes Jewish Hospital, which that reflects about the just under 30% of the people that we serve who are healthcare professionals trying to take care of their very patients, because it speaks to the need that is just so real all the way across the United States. So we get it's through foundations, through individual donations. And we do the Christmas appeal, the holiday appeal at the end of the year. And at our website, stlhelp.org, people can give anytime. And know that it is a very grassroots local organization that is, we balanced our budget. Now that's a beautiful thing, right? Right? In terms of sustainability, because we want STL Help to be around. It's such a unique thing and to last for a very long time. So yes, one can donate, make cash donations at our website, stlhelp.org. They can also register to volunteer. We particularly need people who enjoy repairing equipment and can help with getting even one day a month or one day a week for a few hours coming in and repairing and making our wheelchairs good again. Right? We Frankenstein, take good parts of some items and put them onto where things have worn down, and then from that we get a quality piece for somebody who really needs it. We need volunteers to assist us at special events when we do collection drives. We need volunteers to assist us in terms of publicity and marketing. To learn more, visit our website or call us at 314-897-HELP.
Excellent. That did give people more time to ask questions. So I'm going to ask them. One of the questions was about other places to make referrals if you don't have an item. And I dropped in the chat, there is a website called the IDD Gateway Help Guide. And there is a page in there about assistive technology. And I will note that St. Louis Help needs to be added to that because it's not on there. But there's all sorts of other providers because this tends to be a niche niche area where one organization might be doing durable medical, another one might be doing communication devices. So you need to kind of sort out where the best possible option for you might be. The question I guess I want to ask you, Karen, is that if somebody requests something and you don't have it, do you keep them on a wait list, or they need to keep applying every month, or how does that work?
If we're out of something that we typically get a lot of we ask them to call the beginning of the next week and follow up. We don't do wait lists. It's more of that
Okay.
first come, first serve stuff.
Is there anybody in particular that you do refer to when you don't have something?
Let me think. Paraquad,
Okay.
5 Star Center,
Okay.
Delta Center.
Fantastic. Those are all three great organizations. And people are intrigued by kind of the fact that this is a unique kind of a situation. Do you know what the next closest location for something like this is there another one in the Missouri area that does this kind of free loaning back and forth?
I mean, many communities have got closets located that are quite small, but something on the scale is very unusual. My understanding that in the Carolinas, I believe it's South Carolina, there's one that perhaps rivals us. And the reason
Wow.
we know this is I work with a couple of therapists who that's their business is to work
Mhm.
with across the country to educate people about home medical equipment. And they have just sought out every equipment closet and made this compendium. And they're saying this is a really great what's in
Yeah.
St. Louis. And we say, oh,
Well,
in St. Louis, right?
we are so lucky in this community, and I think we know it, but we don't remember it all the time. And this is such a great resource. I'm so glad that you're here. St. Louis Arc, we've got an equipment lending program, but there's a lot of parameters around it. It's for children under 7, and you have to be on qualified, and we have a waiting list. So but being able to share that equipment back and forth while kids are growing and changing so rapidly is such a wonderful thing for us to be able to do. It's so great to see that you've got a broader and more accessible option for a lot of other people. I really thank you for coming today, Karen. This was super fun.